everyone, this is Dr. Mark Riggs with 5280 Functional Medicine, and this is part one on how to prevent and treat type 2 diabetes with natural medicine. I'd like to start off by talking about what exactly type 2 diabetes is because there are many common myths and misconceptions floating around out there. So, first, type 2 diabetes is adult onset diabetes, or otherwise known as insulin independent diabetes. It's a complex metabolic disorder involving many organs and organ systems, including the liver, gut, thyroid, adrenals, pancreas, muscle tissue, fat tissue, your brain, and the immune system. The hallmark of type 2 diabetes is a loss of insulin sensitivity. It is a lifestyle induced disease and it is not purely genetic. It's induced by many factors, including toxins, stress, sedentary lifestyle, poor sleep, gut dysfunction, hormone imbalances, and certainly a processed, sugar laden, and grain based diet. And regardless of what conventional medicine tells us, it is reversible the vast majority of the time through diet and lifestyle modifications and a functional approach. I like to also discuss with my patients a few things that it'll take to make a change. Type 2 diabetes is reversible and treatable the vast majority of the time, but only if a patient is frustrated with their current treatment approach, motivated to take action, willing to invest in their health, willing to be held accountable, and willing to commit for the long haul. Because type 2 diabetes isn't something that happens overnight. It is a chronic, thought to be progressive disorder. And because it doesn't happen overnight, it's not going to be fixed overnight. There are several factors that influence blood sugar control, and I've listed them here. Everything from your body fat percentage and physical activity to gut health and inflammation and even micronutrient status. The difference between type 1 and type 2 diabetes here, I'll go over this slide and the next slide, and then we won't talk about type 1 diabetes after that because the vast majority of cases of diabetes in the United States are type 2. But type 1 basically is an inability to produce adequate amounts of insulin to sustain life due to an autoimmune destruction of the pancreas, whereas type 2 diabetes is characterized by insulin resistance, and we're going to talk all about that later on. Here's another chart discussing the differences between type 1 and type 2 diabetes regarding onset. Type 2 is typically more gradual. Typically happens mostly in adults, although I'll share with you a slide later on in the presentation how it's getting out of hand, the childhood type 2 diabetes epidemic. Type 2 diabetics typically are obese. There are no autoantibodies present in a type 2 diabetic because it's not an autoimmune condition. Ketoacidosis is something that happens in type 1 diabetics. And endogenous insulin production, that's our body's ability to produce insulin, can be anywhere, can be normal, decreased, or increased in a type 2 diabetic. At the bottom of the slide, I have C-peptide. C-peptide levels differentiate a type 1 versus a type 2 diabetic because it gives us an indirect indication of a patient's endogenous insulin production. So you would expect that to be low or absent in a type 1 diabetic. And typically in a type 2 diabetic, that endogenous insulin production will be through the roof in the beginning. And then as the disease process progresses, insulin production begins to wane. And these patients can sometimes, on their blood work, then begin to look like a type 1 diabetic. So the reason why we care, the reason for putting this presentation together, is because type 2 diabetes is becoming a real problem in our country. It's the fastest growing chronic disease in the United States. Over 17 million Americans have it, and only 1/3 are even aware that they have it. Again, this is a chronic internal disorder, and many of the symptoms can sort of fly under the radar, especially through prediabetes. And so we've got 17 million Americans with type 2 diabetes, another 16 or so with various stages of prediabetes, and you add those two numbers together, and that's about 1 in 10 Americans. The average annual healthcare cost for a diabetic is roughly 4 times that of a healthy adult. The death rate due to cardiovascular disease is 2 to 4 times greater for a diabetic. And type 2 diabetes is a leading cause of blindness, kidney dialysis, and limb amputation in the United States. Epidemiologists also estimate that by 2044, if healthcare costs continue to rise at the same rate that they are rising now, not any faster, that the costs associated with type 2 diabetes will bankrupt the United States healthcare system. And by 2050, in another generation, it's estimated that 1 in 3 Americans will have type 2 diabetes from what it's currently at, as I mentioned, 1 in 10. Some signs and symptoms of type 2 diabetes include excessive thirst, frequent urination, extreme hunger, fatigue, irritability, slow wound healing. Certainly, you're going to notice high or low blood sugar on blood work. You may take a urinalysis and there may be glucose in the urine. And just because you have some of these symptoms doesn't necessarily mean you have type 2 diabetes. And if you're a diabetic, it doesn't mean that you have all of these symptoms. You can have a few or many of them. So now that we know what type 2 diabetes is, most people want to know how it happens. And I've tried to keep the medical jargon to a minimum, break it down, and keep things very simple. So basically what happens is when we eat food, that food, whatever it is, whether it's a Snickers bar or whether it's a sirloin, gets broken down into sugar. That sugar is absorbed into the bloodstream through the small intestine, and the pancreas secretes insulin. Insulin allows glucose to enter the cells. It's sort of like the key to the door, allowing glucose through the doorway into the cell. That being said, food products that are extremely high in refined sugar and flour in particular are broken down extremely rapidly into glucose. And the measurement of how rapidly foods are broken down into glucose or blood sugar is represented by the glycemic load. And I differentiate between glycemic index because glycemic load takes serving size into account, whereas the glycemic index does not. So if you're going to go home and Google image something, you want to Google glycemic load charts. A glycemic load of 0 to 10 is low, 11 to 19 is moderate, and greater than 20 is high. And we want to avoid meals with a total glycemic load of over 30 and space those meals at least 3 hours apart. That keeps the insulin production by the pancreas at a minimum. So, to continue with the abnormal physiology in a diabetic, those refined sugar and flour products are eaten, and what happens is blood sugar rises very quickly. The pancreas then secretes very large amounts of insulin, and insulin spikes. And this cycle happening over and over and over again causes insulin resistance over time, because there is just so much insulin being produced all the time that the cells of the body just kind of tune it out after a while. It's sort of like being at a loud concert and standing next to your friend. The louder the music is, the louder your friend has to talk over the music to be heard. I also get asked, okay, so how long after I eat a meal does what I eat get turned into fat? And basically, it depends on a few different factors, but blood sugar that can't be stored in the muscles or the liver is immediately stored as fat. It immediately begins the process of lipogenesis, which is fat production, and that is why it is all the more important to be physically active, especially if you have insulin resistance, prediabetes, or diabetes. You want to be utilizing your muscle and liver storage forms of energy to make room for the next meal. Otherwise, that that sugar gets immediately processed and begins fat production. And the most harmful of that fat production is not the stuff that looks ugly around our bodies. It's actually the fat that gets stored around the heart, the liver, and the pancreas, which challenges these organs' ability to function. And I can say, as a medical student in the cadaver lab dissecting bodies, the people that died from complications due to type 2 diabetes, they were almost always obese and they always had fatty organ disease. That is, fatty heart, fatty liver, and fatty pancreas. So much so that the organs were almost unrecognizable. They were so mucked up and caked with fat. So, to summarize this process, we abuse refined processed foods of low quality and high quantity, typically in our standard American diet, which causes extreme spikes in blood sugar, which causes the pancreas to respond with extreme spikes in insulin. Over time, the receptors become insensitive or resistant to insulin, and as I just discussed, that same process begins to pack the organs full of fat. Both of those processes cause insulin resistance and decreased organ function, leading to type 2 diabetes. I'd just like to emphasize again that the hallmark of type 2 diabetes is insulin insensitivity, otherwise known as insulin resistance. That is the hallmark. That is type 2 diabetes. Type 2 diabetes is not high blood sugar, which is what many of my patients come in, and that is their notion of what their disease process is. That is pretty much most all of what anybody understands about their disease if they come in with type 2 diabetes. But it is not high blood sugar. High blood sugar is the symptom of the problem, and the problem is insulin resistance or insulin insensitivity. Insulin resistance is defined as when the insulin receptors fail to open when they are stimulated by insulin. Then the sugar can't get into the cells, blood sugar levels continue to rise, the pancreas responds by the slowly rising levels of blood sugar by secreting more and more insulin. Again, using the concert analogy, trying to scream louder and louder and louder over the noise of the concert in order to be heard. And this is why an early stage diabetic will have elevated fasting glucose as well as elevated fasting insulin. Part 2 of the presentation is coming up next, and I will discuss risk factors for type 2 diabetes. This is Dr. Mark Riggs with 5280 Functional Medicine. Thanks for listening.